I think relationship health is both a foundation and an umbrella. Now, let me explain what I mean by that. When I first trained as a clinical psychologist, I was fascinated, but also completely confused. We were taught lots of different models: behavioral, cognitive, psychodynamic, family approaches. But I remember thinking, but how do all these fit together? So, that question, how does this all join up, has really stayed with me throughout my career, because when you're working with real people and real families, you need something that helps you make sense of it all. But what I gradually realised is this: all of these different approaches, in different ways, are actually talking about relationships. But we hadn't had a simple shared way of naming that. For me, coming across the phrase relationship health was that missing piece. It was the moment that things started to come together. Because relationship health is a foundation concept. If we understand the basics of how relationships work, then everything else becomes easier to make sense of in child and adult mental health, for example. But it's also an umbrella, because each of these different models, they're not wrong or competing, they're each offering a different perspective on the same underlying thing. So instead of trying to choose between approaches, we can start to bring them together. And that, I think, opens up a really different way of thinking about how we support individuals, families, and systems. So if that idea resonates with you and you're interested in exploring relationship health as both a foundation and an umbrella, I'd love you to take a little look more at more of the work. So you can find more details at imatatraining.com or let us know your questions.